Okay, the hip 90-90 position, probably hands down the best thing you can do to maintain your hip mobility. If those hips start to get stiff, you know, we slam a lot, you land on one side a lot, when we get that big swell on their hip from slamming too hard, knows how uncomfortable that can be. And once you start to lose your hip rotation, okay, so it moves, your leg moves around this way, then a lot of other issues can appear. It could get pain in the knee, pain in the ankle, pain in the lower back. So for this one, the hip 90-90 position, its name comes from sitting in a position where this leg is at 90 degrees, this leg is at 90 degrees, so your toe, heel, knee, and heel should all be in a straight line. If that's incredibly uncomfortable and you just can't stand it and it pinches, because it could, just bring that leg in a little bit closer, bring that leg in a little bit closer. But the idea over time is to get to this point. We should be able to sit upright without the use of our hands. I'm not quite upright because I still need to work on this, without falling over. This is my good side. If I move to my tight side, again, 90 degrees, 90 degrees. If I take my hand off the floor now, I can just about, but everything in my body wants to send me falling over that way. That is due to a lack of internal rotation on this hip, which is your knee turning inwards. So in order to improve these positions, you're basically going to sit here. I'm going to grab hold of this shin. I'm going to grab hold of this shin, and I'm going to try and pull myself upright this way. This is where breathing is going to be incredibly useful. Whilst I'm doing that, I'm trying to push this knee into the floor, and I'm trying to push this knee into the floor. So this isn't a passive movement. You're active through the whole time. So I'm going to grab these two, take a breath in, push down, breathe out and pull myself upright. Breathe in, push down, pull myself upright. Okay, my body is facing pretty much in line with my front knee, maybe over to the side a little bit. Okay, but you want to do this for either 10 breaths on one side or 30 seconds on a clock. Either, whichever you feel more comfortable doing. Okay, so breathe in, pull, breathe out. Breathe in, pull across, push knees down, breathe out. Okay, and over time, if I let go, I still want to fall over. If you can sit upright on both sides, your hips are in good condition. Do that one as often as you possibly can. If you struggle on one side, do this one more, 2 or 3 times a day, because the benefit you will have long term for your hips and for your lower back will be fantastic. So do this one as much as possible.